our 110th in-person briefing so far in response to the COVID-19 pandemic in British Columbia, when we're honored to be doing it here on the territories of the Squamish, of the Musqueam, of the Tsleil-Waututh people. Tomorrow, Friday at 3 o'clock, we'll be providing written briefing with detailed information and case counts and other relevant information for the COVID-19 pandemic in British Columbia. And with that, it's my honor, as always, to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. We'll start by reviewing the update of our cases here today in British Columbia. We have 89 new cases who have been diagnosed with COVID-19, including one epidemiologically linked cases, bringing our total number of cases in British Columbia to 6,041 people. That includes 2,012 people in the Vancouver Coastal Health Region, 3,155 in the Fraser Health Region, 178 people on Vancouver Island Health Region, 450 people in the Interior Health Region, 167 in the Northern Health Region, and 79 people who reside outside of Canada. We now have 1,175 active cases in British Columbia, of whom 34 are in hospital, 11 of whom are in critical care or ICU. We sadly have had one additional death in long-term care, bringing the total number of people who've died from COVID-19 in BC to 210. And as always, our condolences and our thoughts go to the families, the communities, and the care providers of this person. We have 2,801 people now currently under active public health follow-up and 4,644 people who have fully recovered. We have 2 new healthcare outbreaks, both of which have a single person identified, and investigations and an outbreak response is ongoing. Those are at the Charrington Place Long-Term Care Home in Fraser Health and the Point Grey Private Hospital in Vancouver Coastal Health. The Maple Ridge Seniors Village outbreak that is now declared over. So that leaves us with 11 active outbreaks in our healthcare system and 730 people who have been identified, 443 residents and 287 staff. We have no new community outbreaks, but as we know, there are a number ongoing exposure events where there has been transmission to people in communities across BC. And please continue to check our health authority websites and the BC CDC websites regularly for guidance on what you need to do if you've been involved in one of these exposure events. I'm now going to put my glasses on. I'm now going to walk us through some of the update on the numbers and some more information and the modeling that we've been using, as Minister Dix mentioned, to guide our response here in British Columbia. So our last week, this is a profile of what we've been seeing. As we know, we've had an increased number of cases per day, again, in the past week, with 547 new cases. The one thing that you will note is that the median age has gone down. Where previously the age of our cases was in the 50s, we've now gone down to a median age of 41. And what that reflects is the fact that many of our new cases are in younger people. Though our hospitalizations have gone up slightly, again, the hospitalization rate remains very low. And it has actually come down from when we were in the midst of our first wave of this pandemic, where about 20% of our cases ended up in hospital. And that, again, reflects the fact that many of our new cases are younger people. As of last week, we had 4 new people who had died from COVID-19. Again, the median age remains very high, reflecting that this virus is most lethal to our elders and seniors. In addition, we've had a number over 4,200 removed from isolation. About 79–80% of our cases now have recovered, and that should not say the median age was 906. That is a reflection of the actual active cases we had last week. This is an update of the geographic distribution by HSDA, Health Service Delivery Area. And again, this week we have seen active cases in